Hey guys, so do you have a hard time tolerating topical prescription retinoids for treatment of acne? And if you feel like you've done everything under the sun but still find it very irritating, well, today's video may be very helpful for you. I want to talk about short contact therapy for using topical retinoids for treatment of acne. Hi, welcome back to my YouTube channel. My name is Dr. Jenny Liu. I'm a board-certified dermatologist in Minneapolis. And if you like what you see, give this video a thumbs up and consider subscribing to the channel. You can also find a lot more relevant skincare and hair care content on my social media channels like YouTube and Instagram. Okay, so before we dive into what this short contact therapy is, let's talk about the importance of you incorporating a topical retinoid into your acne treatment routine. Why topical retinoids is really one of the most fundamental treatments that dermatologists will prescribe for treating mild to moderate acne. Certainly, it's not going to be helpful for severe nodular cystic cases, but for the average acne that comes into my door when I see my patients, and for individuals that ask me on social media, I always recommend a topical retinoid because we know topical retinoids help in treating as well as preventing acne, as well as post-acne marks, and to a degree over time with use, improving acne scars. Topical retinoids really work at the heart of acne, your oil glands. It's anti-inflammatory and then to a degree antimicrobial, reducing the burden of the bacteria that causes acne. So there's really a lot of benefits to using a prescription topical retinoids when it comes to treating acne. Now, obviously, the major downside to prescription retinoids is really the irritation. In certain individuals, they're not able to use it on a regular basis to really get the benefits for treatment of the acne, or they may not be able to use it at all. Now, obviously, to caveat that, if you're looking for retinoids purely for the purpose of anti-aging, then I highly recommend picking an over-the-counter drugstore retinol that has been shown to be just as effective but far less irritating. But we do know is that retinol is not as effective for treatment of acne. Certainly can help with post-acne marks and a little bit of the scarring, but if you have active acne, then you really need to seek out a prescription retinoid, or at the very minimum, start with over-the-counter adapalene. Adapalene is by far the least irritating, the least potent, but can still work very well for certain individuals. And when patients come to see me, if they've trialed a course of the adapalene and they're still breaking out, this is where I will escalate to a stronger strength of prescription tretinoin or even maybe Tazorac or tazarotene. Ways to tolerate a topical retinoid, prescription retinoids are, when I always recommend my patients when you first start, you really just want to remove everything that you have been using in your routine and really just stick to a gentle cleanser, a really rich nourishing moisturizer, and sunscreen. And if you use vitamin C, niacinamide, other things, snail mucin, what have you, just temporarily remove that until your skin kind of build up that tolerance, because really the irritation comes within the first couple weeks to a month of using a topical retinoid, and we call that the retinization process. And when you do start, I recommend starting maybe only 1 to 2 times a week and gradually, depending on your skin type, gradually adding in a night per week, maybe over the course of a month to 6 weeks. See if you can build up that tolerance in using it nightly. And when it comes to treating acne, the more regular the nightly use is going to be more effective than say using it only a couple times a week, where really the anti-aging benefits come through. So, for anti-aging, you certainly don't have to use it every night. 3 times a week has been shown to be effective, but when it comes to treating acne, consistency and daily use is going to give you a lot more benefits. But if you are one of those individuals who have literally tried everything under the sun and still cannot use a retinoid regularly to treat your acne, short contact therapy may be a way for you to incorporate a topical retinoid for the treatment of acne while mitigating those irritating side effects. So what is short contact therapy? Essentially, as the name implies, is applying an active ingredient, a medication most commonly, onto your skin and leaving it on for a shorter amount of time compared to say what we normally would do like overnight or throughout the day, and then removing and washing it off. And in this way, it still allows you to receive majority of the benefits from that medication while, again, mitigating the side effects. The concept is not new, to be honest. On a daily basis, as a dermatologist, I recommend short contact therapy to my patients, and I certainly have talked about it in many ways in my other videos. I've mentioned it. Really, the most common way is with benzoyl peroxide cleansers. You guys know how much I love that benzoyl peroxide for treatment of acne, but it can be super irritating, which is why I frequently recommend the use of benzoyl peroxide in a cleanser, short contact therapy, versus like a leave-on treatment, because the latter is far more irritating, and that short contact therapy in a cleanser form has been shown to be just as effective and far less irritating. So you can actually do the same thing with a topical retinoid for treatment of acne. And this is not something I made up. There have been actually clinical studies done using topical tretinoin as well as adapalene and tazarotene for the treatment of psoriasis using the short contact therapy method, and have been shown to be helpful for improving psoriasis as well as acne. So in these clinical studies, what's been shown is that individuals would apply the topical prescription tretinoin at night and leave it on anywhere from maybe 1 minute if you have really, really sensitive skin, all the way up to 30 minutes if you're able to tolerate it. And you can certainly work your way up as time goes on. You know, the study ended at, I believe, 24 weeks, but really around a couple months is when individuals start noticing an improvement in their acne. And compared to the leave-on method, the short contact therapy is far less irritating. And like I said, studies have shown that this method is not just effective for acne using tretinoin. It's also been shown using adapalene as well as Tazorac for the treatment of psoriasis. So this is what you want to do if you want to give this method a try. So what I recommend doing is starting off the evening with a gentle cleanser, or even maybe a double cleanse if you wear a lot of makeup or waterproof sunscreen to thoroughly remove everything. I'll just share with you the two that I'm currently using, and one is from the Pure Skin line from e.l.f. I really love this one actually. I use it in the morning to gently remove everything, but certainly this can be a great go-to cleanser for those individuals with dry and sensitive skin. It's creamy cleanser. It's fairly effective at removing everything, and it's not going to leave a film, like a residue on your skin. If you're into cleansing oils, or if you like to double cleanse, then I'm currently using this one. I recommend this one from e.l.f. Project. This is a cream beauty line. I really love the scent of this cleansing oil. It's very effective at removing everything, but again, it's not going to leave that residual film on your skin, and your skin feels clean after using it. So you can certainly use this as your cleanser or use it as the first step of your double cleansing routine. Anywho, just use a gentle cleanser to remove everything, and make sure you do remove everything thoroughly. Then go ahead and apply your topical retinoid prescription or adapalene, and take the same amount, like a pea-sized amount, and just spread it everywhere evenly on your face, but avoiding your eyelids and the creases of your nose and the corners of your mouth. Leave that on, maybe starting with like a minute or two, working yourself up to 5 minutes or even 30 minutes eventually, if that works for you. And then just go ahead and rinse that off, wash it off. Don't need to use another cleanser to remove that, just water is fine. And then make sure to really seal in all that hydration from that washing with a good, rich, thick moisturizer. One that I have been using right now for the winter is from Skinfix. Really love this one. It's got peptides, it's got ceramides, nourishing plant-derived antioxidants. That's very soothing. Another one I really love for the winter is from Roche-Posay, their Lipikar Ap+ line. That moisturizing cream is super rich but non-greasy. It's great for face and body, and that is really what I recommend for the winter, and that's what our family uses for the winter, to be honest. And that's really it. I certainly do not recommend using any other actives or products in your routine at the nighttime, because you want to minimize the risk of irritation. And if you're doing this method, chances are you have pretty sensitive skin. So not that you can't use anything for the entire duration of treatment if you're going to be doing this for how many months, but certainly when you're starting off, avoid any other products and gradually add in a product or two over time, depending on how your skin reacts to the topical retinoid. And then in the morning, just go ahead and remove everything with a gentle cleanser or a splash of water, put on your moisturizer and sunscreen. And speaking of sunscreen, I just want to mention one that I am currently loving right now, and that is from Purito, their daily go-to sunscreen with SPF 50, PA 4+. Not sponsored, but I am pretty much done with this tube, and I want to show you guys before it's completely gone. But this has been such a nice, elegant, very smooth, hydrating and nourishing sunscreen for my skin for the winter. It's non-greasy and it's very lightweight, but it does have a little bit more nourishment. So I think it's really best suited for individuals with maybe more normal to dry skin, especially if you live in a colder environment in the winter. For those with really oily skin, you may just find it a little bit too much. But again, I think it really depends on where you live. But I really have been loving this sunscreen, so highly recommend checking it out if you haven't. Okay, a few other things to consider. Now, when it comes to treating acne, we never really recommend relying on one ingredient or one product to treat your acne effectively. You really want to tackle it from all angles to, maximize your acne treatment. And as a dermatologist, you probably have heard that we recommend the dynamic duo over the counter, which is benzoyl peroxide and a topical retinoid. And since you're using the topical retinoid at night as a short contact therapy, there are other ways you can incorporate your topical benzoyl peroxide. I mean, certainly you can use it as a spot treatment to treat individual breakouts. If you're tolerating the short contact therapy well with the topical retinoid, you can certainly, add on a less irritating benzoyl peroxide treatment to spot treat here and there. Ones I really recommend that are a little bit more gentle is the Effaclar line from Roche-Posay, as well as Neutrogena has the Stubborn Acne line that has 2.5% micronized benzoyl peroxide. But the other method you can consider is incorporating a benzoyl peroxide wash in your routine. Now, because you're kind of using the topical retinoid in the evening as like a cleanser, I don't recommend, layering a benzoyl peroxide cleanser before that. You certainly can, it just may increase the risk of irritation. So what you could do is use a benzoyl peroxide cleanser in the morning. And the two that I really recommend if you have super dry and sensitive skin is one from Cerave, their acne foaming cleanser that contains 4% benzoyl peroxide. And then Cetaphil also came out with a new benzoyl peroxide cleanser this year, Complexion-Clearing benzoyl peroxide cleanser, and I believe it contains like 2% benzoyl peroxide. And that one is super creamy cleanser. And I feel like sometimes I almost have to wash my face really well because it kind of leaves a little bit of a residue because it's just so gentle and creamy. But those two I highly recommend. It works really well, but it's not going to dry out your skin. Now, because they're pretty gentle, I certainly don't recommend you relying on those medicated cleansers as your cleanser to remove everything if you are using them at night. I do recommend here either using a cleansing oil or micellar water if you do wear makeup and sunscreen to really effectively remove that so you don't really increase chances of clogging your pores, and then using one of those more gentle medicated cleansers to treat your acne. A few other things just to remember is that with this short contact therapy, what we do know from topical retinoids is when you apply it to your skin, 80% of it really absorbs into your epidermis, so the top layer of your skin. And the rest kind of slowly diffuses into the deeper parts of your skin, but really it doesn't go much deeper beyond your skin. And that absorption happens fairly quickly within the first minute or so. Now, the question we don't know is the topical retinoid going to be as effective at reducing acne marks, acne scars, as well as helping with unclogging pores? Because those are a little bit trickier. Those are actually changes within your skin that requires more of a long contact time for changes to happen in your skin. And with short contact therapy, we just don't have information on whether that is going to help. But we do know that short contact therapy is helpful for inflammatory acne. So lastly, short contact therapy has not been studied in the context of helping with collagen, fine lines, wrinkles, and that anti-aging realm. That is because for those changes to occur, you're really relying on tretinoin going deeper into your skin and making those changes, messaging your skin to produce more collagen, elastin, helping with fine lines and wrinkles. And the short contact therapy, I just question, because you're leaving it on your skin for a short amount of time, is it enough to send out those messages for those metabolic processes to even occur on your skin? And if it does, what is the amount of time you need to have tretinoin on your skin for it to occur, and how long do you need to use it for that improvement to be seen? So here, I would not rely on short contact therapy for improving fine lines and wrinkles. And if you have a hard time tolerating tretinoin, I recommend going with an over-the-counter retinol or retinol that have been shown to be just as effective and far less irritating. All right, guys, so that is a quick video on using short contact therapy for tretinoin in the treatment of acne. Comment below, let me know, have you heard of this method? Have you tried it? And if you are using it, what do you think of it? Is it working for your acne? I would also love to know what other topics you want me to talk about next time. I would love it if you can give this video a thumbs up and subscribe to the channel, and I will talk to you guys next time. Bye.